The easy way to remember the muscle of mastication and their action is, regardless of what is the origin of the muscle, just pay attention to the insertion. Because when you look at the insertion of the muscle, all the muscle of mastication are inserted to the mandible only. You just have to see that when the muscle contract, it is going to pull the mandible in what direction. Now, in the first picture, looking at the temporalis muscle, the way the temporalis muscle will pull the mandible, vertical fiber will pull it upward, and we have a horizontal fiber pulling it backward. So the action of the muscle is elevation and retraction. And retraction is a unique action of temporalis muscle. No other muscle of mastication will do that. The second muscle you're looking at here is a masseter muscle present outside the ramus of mandible. But again, look at the fiber, the way the fiber are oriented. When the muscle contracts, it will again elevate the mandible. That is again the main action. Though it helps in protrusion also, but that is not the main action, guys. The main action of the masseter muscle is the elevation, though it helps in protrusion as well. And then comes the pterygoids. Medial pterygoid is inside the ramus of mandible, but the direction of fiber is more or less like masseter only. That's why the medial pterygoid muscle will also help in elevation and main muscle for elevation, but it does help in the protraction also. If you have to choose between the protraction and elevation, elevation is going to be the major function here comparatively. And finally, look at the lateral pterygoid muscle, which is horizontally oriented. The upper fiber of lateral pterygoid muscle will pull the mandible forward, and the lower fiber of this lateral pterygoid muscle will pull the mandible downward. So it is a muscle for the protrusion. And this protrusion of the mandible, like taking the mandible forward and downward, will bring the mandible in the position where the other muscles can act on it more effectively and cause the depression of mandible. The major opening of the jaw is done by the muscle that is digastric muscle, then geniohyoid muscle. But to bring the mandible in the position so that the depression can be done is done by lateral pterygoid. So I can say lateral pterygoid is helpful in the depression of the mandible or opening of the mouth here. So these are the four muscles of mastication and their action when you act them bilaterally. Pterygoid muscle acting unilaterally. Like if you just talk about the lateral medial pterygoid muscle acting on one side only unilaterally, their job is to rotate the mandible on the other side. Like if I deviate my jaw, let's say toward the left side, it is done by the action of the lateral and medial pterygoid of the right side. So ipsilateral action of pterygoid is to rotate the jaw toward the opposite side. So that is about the muscles of mastication and their action.